When it comes to going to the dentist, you could probably find lots of excuses not to go. First and foremost on the list might be, like me, a little bit of fear. We're going to address that today with Dr. Matt Vandermolen of Advanced Dental Care here in Springfield. Thanks for having us in.
Oh, thank you, Tim.
I would imagine you experience all sorts of reasons. People don't want to come see you. First, let's talk about what you do in general, and then we'll address some of those fear concerns.
Well, basically, we see all patients from ages of 2 to 102, I say, and there's 4 doctors here, so we treat all types of dentistry, take care of pretty much all of your needs. We're known for sedation dentistry. We're one of the few offices in the state that offers sedation dentistry, so you can sleep through your dental care.
Nice.
We offer orthodontics. We offer all kinds of different services for all age ranges.
As soon as I walked through the door, I noticed you guys specialize in a lot of like chipped and cracked and missing teeth kind of scenarios. Mm-hmm. But I would also imagine that when people are having those work done, the unknown of what it's going to take and what it's going to look like afterward, that's kind of a big deal. How do you guys address that?
Right. So a lot of people have a lot of fears, like you say, but the fear is, basically we don't like to change too much. We are always afraid of what's going to happen. Even though we know our mouths aren't quite right, it's like, well, what are they going to look like when we're done? And so we have a technology called preview technology, and that enables us to show patients their face before, and then after treatment, we are able to do a simulation of what their smile will look like.
It's just a really advanced Photoshop kind of thing,
Yes.
Right? Where you're taking a picture of somebody, and then you sort of imagine what you're going to do to their mouth so that they can see.
Right.
How does that play out in practice? Do you have any examples of people that from before to after were just a world of difference?
Yeah, so we have patients, for instance, we have a patient named Jeff who came in and he had teeth that just were discolored and chipped and didn't look right. And he's a good looking guy. But basically, he's like, well, I'm not really sure what it's going to look like if I have white, beautiful teeth. So we took Jeff's case and we simulated what we thought we could do for him. That helped him to get the courage to move forward. And then of course, we did the treatment, and I think it even came out better than our simulation. So now Jeff, he's already a good-looking guy, but now he's got a great smile to go with it, and he's just really happy and really confident and comfortable with his new smile.
I think most people understand what a dentist in general does, right? You have fillings and cleanings and root canals and all that kind of stuff. Right. But the more the cosmetic stuff, at least for me, is a bit of an unknown. Everything from whitening to caps to dentures. Can you talk through some of the options for someone who's not happy with their smile, they're not happy with the look? It's not a health issue, but it's
right.
more of a cosmetic thing.
Right. Well, basically a lot of people struggle with things, and we as dentists, like you said, we have this whole list of things to do, and I know you as the patient don't want to come in, you don't necessarily want porcelain veneers or crowns. What you want is a nice smile that you're confident in, and you want a smile that you're comfortable with chewing, that you're able to have, be comfortable with everything that goes on. And so when we have a whole menu list of things, basically just sit down and that's what you need to do. Visit with your dentist, come to us and say, here's what I don't like, and then we'll figure out all the parts and pieces that will make it come together.
Let's say you have someone who might be addicted to Diet Dr. Pepper, and their teeth are slightly discolored. Is there something you can do for that person?
Well, first get rid of the Diet Dr. Pepper.
Man, I was afraid you were going to say that. All right, you're no help at all. No, just kidding. If you need anything from A to Z, general dentistry to you just don't like the look of your smile or you're looking to have it fixed, he can not only do it, but tell you what it's going to look like before he does it, which is really cool. It's Dr. Vandermolen here at Advanced Dental Care in Springfield. If you need more details, you can go to our website. We'll get you everything you need at ciLiving.tv. Thanks. Appreciate it.
Thank you.